My name is Dan Tuttle, and I am the Director of Health at the Stupski Foundation. I think investing in health is everything. It's so easy to take health for granted, and we saw during COVID how many of us did that. We also saw how interconnected health was with all of the other aspects of our lives, our jobs, our well-being, our sense of community. And so if you're not putting health right at the center, you're kind of missing part of the point.
Aloha. My name is Sulma Gandhi, and I lead our health work in Hawaii. I believe health is inextricably bound to everything, to our land, to our water, and to one another. Health equity is about removing obstacles and disparities so that we all have the opportunity to thrive and to live to our highest potential of well-being.
We think about a number of principles in our grant making across all of health in both geographies. We believe in big institutions' ability to change. We think it's more feasible when there are pathways to reimbursement. So our philosophy is if we can provide some grant money up front to get these services started or expanded in certain places, they get to a volume where they can be financially self-sustaining. We're also equally paying attention to and resourcing smaller community-based organizations because they have additional abilities and flexibilities to both provide culturally relevant care and provide a wide suite of services that advance somebody's holistic well-being in ways that are grounded in our broader holistic view of health rather than a more narrow clinical definition of health.
When you're talking about access, our rural communities don't have the same kind of access as our urban communities, and that impacts our neighbor islands most especially. There's shortages of everything from transportation to providers. So that is one of the lenses that I think about. And the other is that it's our systems. So where can we support in ways that integrate all systems? Because health isn't just about the clinical intervention when you're in the doctor's office. There's so much upstream prevention that we can think about. So we have partnered with a number of community health centers, and it comes with both of those lenses of supporting those in our rural communities and thinking about opportunity and access, as well as thinking about systems. So these organizations, they do everything. They do the point of care clinical work, but they also are working around and thinking about that transportation and the food and housing and all of the different ways that can build those paths towards individual well-being, but also family and community well-being. When I think down the road to when we are closed, my wish and the idea of impact to me is really about power and shifting power to community, to those leaders who have the wisdom and the knowledge and these amazing local staff who know best for what to do in those provisions of services. It is really about transferring that power.
By the time the foundation closes, I want to see every little munchkin on the street have the exact same chances to develop to her fullest potential as the one that I have at home. And I think if we are paying attention to creating overlapping surrounding supports that meet families where they're at, we can make up for the lack of a comprehensive system for early care in the US. I hope that every individual in the Bay Area is going to have access to information that actually allows them to navigate their own care journey towards the end of life. And surprisingly enough, I think that's a possibility.
For me and for us, our ultimate goal is for just healthy and conscious communities where we are in partnership, where we are in collaborative relationship, where we're responsive and where we have that sense of responsibility to one another and to serving our community.